Hola everyone! Welcome to Flexibility Script. This video will be going into the use of the lacrosse ball and the Voodoo Band to be able to get a nice release to our forearms. In addition to just a lacrosse ball, if I find myself that maybe in a little bit more discomfort as I roll along the tissue, I can use something called the pinky ball. So the pinky ball, in comparison to the lacrosse ball really has no give, and the pinky ball, when I push into it, allows for a bit more give, so it's just a little bit kinder to the tissue. If I'm experiencing a lot of discomfort whenever doing any sort of myofascial release, so if I'm doing the forearm or the quads and I'm using a lacrosse ball, if I ever find that if I had to say on a scale of 1 to 10 in terms of discomfort, 10 being the most uncomfortable, if I'm at an 8, 9, or 10, anywhere above a 7, I'll choose a softer tool to be able to get a nice myofascial release to the tissue as opposed to enduring a discomfort that's on that high level, because usually your body will tense up and that release will be a lot less effective in comparison to choosing a softer ball that will allow for a more effective release that you can actually relax into. So if you find me reaching for the pinky ball, it's because I'm a bit uncomfortable. But the release for the forearm is very, very simple. When we get into the Voodoo Band, it's just a little technical with going into how to wrap the Voodoo Band, but once it's on, a lot of the same movement techniques that you use with the lacrosse ball are used with the Voodoo Band. So to get started, I usually will find something. I can do it on the floor, meaning I can place a lacrosse ball on the floor, but I usually like to find a nice sturdy surface, so I'm going to be using the desk today. But you want to find something nice and sturdy that you can be able to take the ball, put it on, and allow for somewhere that allows you to be able to move your wrist into nice ranges of motion. And if you're on the floor, then you won't be able to really get into that kind of motion. So you'll take the ball, place it in, and very, very nicely you can gently roll the tissue nice and slow as you're going into releasing the tissues of the forearm. Now, if you wanted a little bit more intensity, you can super friend yourself, and by that I mean you take your hand, you place it on top of your forearm, and then from there you're able to create a bit more pressure to get into the tissue, and then you can gently roll. You're pretty much self-massaging yourself as you're rolling through. As you roll through, you can kind of pick out areas that may be a bit more what I call spicy, but really spicy spots are really just areas that may feel more tender, meaning those areas are areas where the tissue may be a little bit more restricted. So for me, right there is a bit of a spicy spot, so I can stay there, I can super friend myself, and then from here I'm just taking my hand and going into some flexion and extension, getting as much motion as I can while the tissue is in a compressed state. So not only are we releasing the tissue by just allowing the ball to sink in, we're also adding a range of motion component in order to restore some movement and freedom back to the tissue. So kind of you're pinning the tissue and then you're stretching it at the same time. So kind of doing two things at once. I can also go side to side, I can also go circles, I can also close my fist, make a fist I should say, and then go into flexion and extension. Another way to get into the forearm is do the tissue on the other side. So I'm going to stand up for this one here. I'm going to be taking the ball and same thing, just gently rolling it through the tissues of the forearm, but just on the back side here. As I roll through, same thing, when I roll, I go hunting. So as I roll, I hunt, trying to find that tender spot that may be calling my attention where I have the most restriction in the tissue. Right there. So I'm going to be there, I'm going to be super friending myself, and then same thing here, some flexion and extension, some side to side, some circles. Kind of just playing with it. I could be there anywhere. Sometimes I go for repetitions where I do 10 ups and down, 10 side to side, 10 circles one way, 10 circles the other. Anything that kind of amounts up to at least 2 minutes of work on that spicy spot will help release it. So very simple, but very, very effective. Nice to do both pre-activity and post-activity, especially if participating in sports where you're gripping a lot. So horseback riding, pole, any sort of gymnastic sport, pull-ups, anything of that nature. Now the Voodoo Band, like I said, I really like it. The Voodoo Band will be doing a lot of the similar techniques, except instead of just finding a spot where it's tender, the Voodoo Band will be compressing all of the tissue. For this release, I'm going to be focusing in on the tissue of the back side of my arm here. Now, if I was to do the lacrosse ball and I was doing both sides like I just did, if I find that there's more tenderness on one side, then I'll put that compression on that side. I can also do just 2 wraps and do 1 wrap where I compress here, 1 wrap where I compress here. For the video today, I'll be doing the compressing around here. By the compression, I mean that when we wrap the Voodoo Band, we're wanting to have a 50 to 75% stretch on that tissue that we're wrapping. Say, I would be 100% me pulling it as much as I can. We're trying to avoid that, but a good 50 to 75% tension over that tissue you're wanting to have the greatest effect on is great. The tissue on the backside won't have much compression to it. Now, one of the things with the Voodoo Band, and I've mentioned this in previous Voodoo Band videos, is that when you're wrapping, you're trying to have what I would say like a 1/2 inch overlay. So as I'm wrapping, I'm covering about half of what I've put down. And except of course there'll be some compression to it, but every time I create a wrap, I cover half of what I put down to keep it nice and good all the way up, as opposed to it being all jumbled up one on top of the other. When I do the wrap for the forearm, I usually will find, actually for forearm, elbow, sometimes anywhere along the body, but I usually encounter the issue more with my upper body, and that's that first wrap usually won't have a lot of tension, or it won't have any tension to it, just as I'm trying to get the band to kind of get nice and stable. Whenever I'm wrapping someone else, it's usually a little bit easier and I can get tension right from the start. But when I do myself, I usually will do 1 wrap that has no tension whatsoever, so you'll see what I mean as I get started. So from here, I got my forearm here. I place the band right above the wrist. Start over here. So place it right over the wrist, and again, this first wrap is not going to have much, not any tension. I'm just kind of trying to place it down so that I can just get the band going. I think I'm going to need 2 wraps there. So I got the band kind of nestled in. Once I get the band nestled in, that's when the compression is going to begin. So what's going to happen here, I usually will use my leg to help myself. That way I can pin the tissue. And it doesn't matter if I was wrapping, I say, this way or this way. It doesn't matter. Just get the band on and get to work. If there is swelling, it's really good now to wrap up towards the heart in the way I'm doing it. So pinning the tissue here with my leg, pinning the band with my leg, so that way I can create a stretch of the band, wrap, and then there's no tension along the back. And again, I'll pin, create that tension on the band, that stretch, wrap it around my forearm, and then release that tension as I go around. Again, pin, stretch. As I keep wrapping, I keep covering half of what I've put down. Again, pin, stretch, wrap. And I'll keep working my way up towards my elbow. And I usually just help myself as much as I can. So after I wrap, I kind of hug it in towards me. And then again, I'm getting up toward the top here. If I get toward the top and I have any remaining band, which I do, I'm just going to be kind of making this little letter X kind of pattern to it. So by that I mean I'm going to stretch, but instead of wrapping around, continuing to wrap up, I'm going to be wrapping around, like to make the letter X here. And again, come up, finish making that letter X. And then with whatever's left of the band, which you see there is still some left, I'm just going to find an area where I can be able to wrap that little extra piece down on. So I'm going to come right here, wrap, do-do-do-do-do, do-do-do, do-do-do, here's good, do-do-do, ta-da! Alright, so now that it's wrapped, it's pretty simple. All I'm going to be doing is just, now that it's compressed, just taking that tissue into some ranges of motion. So just going to be going into some flexion, and I can use my hand here to be able to help me, which I really like. To flexion, extension, I can turn it the other way around. Ooh, that felt nice. Some flexion, extension. Again, that compression is going to be releasing the tissue, and then I'm adding this range of motion component to help restore movement and release any sticky, spicy spots. Now from here I can make a fist, and I love the fist because the fist will get into the finger flexors and extensors, and it's intense, but that compression feels really nice. Now from here I can also take it and go into some circles. Circle the other way, side to side. Usually the band can stay on from 30 seconds to 2 minutes. What you usually find, and when you know it's time to release the band, is you may start feeling tingles, and usually respect the tingles and remove the band. But you'll see, and you should be able to recognize when your skin starts turning. This is my normal hand, and this is my voodooed hand here. That skin starts turning the color of a cadaver, meaning the color of a dead person. When you see that, know that it's time to remove the band. And once I see it, hey, dead hand, remove the band. And any markings that are left on your skin from the voodoo band wrap, they'll go away as blood flow starts coming back. And then you'll see this nice rush of blood flow that starts happening. And you'll see the arm starts turning bright red as blood flow starts coming back, and it just feels good and free. Any pain that I maybe have experiencing around the wrist is also better improved, and sometimes all the way cleared up, depending on how much. If you're carrying a lot of tension in your forearm, it'll end up causing some restrictions in your wrist range of motion, and so it can refer pain down to the wrist, and also it can refer pain up to the elbow. So really working on the tissue on the forearm can help make improvements in pain that you may be experiencing in both. Whenever I do the voodoo band, like I said, it doesn't stay on really for more than 2 minutes. You'll start seeing that skin color change, and when you see that, it's usually time to remove the band. When you're doing the voodoo band, you can do it before you train, after you train. Both are great. You can do it 2 to 3 times per day. If you have a lot of swelling or things are not very happy, you can do the voodoo band more, up to 10 times a day, 5 to 10 times a day, to see an improvement in the swelling. I usually keep it to 2 to 3 times, as I usually find that really helps clear up the tissue of my forearm. And usually on the second wrap, I'll put that compression around the other side of my forearm so that tissue gets released as well. Give it a shot. It will be a big lifesaver and game changer in terms of staying good and free and being able to continue to train to your heart's content, along with staying injury free.